A professor from Stanford showing incredible courage in the face of a terminal cancer diagnosis. Elizabeth Cook spoke to Dr. Lin about how he's hoping to use his battle to inspire a new generation of doctors and professors.
This week, leading experts are meeting at Stanford University to talk about the rising rates of lung cancer in people who have never smoked. The man leading this first-of-its-kind summit is Dr. Bryant Lin. Dr. Lin has dedicated the past 6 years of his life to raising money and awareness to rising rates of this disease in Asians. Now, he himself is part of this troubling statistic. But his diagnosis has not stopped his mission, and now he is paying it forward.
I always get a little anxious before chemotherapy. I'm still getting chemotherapy every 3 weeks.
Dr. Bryant Lin has been a physician and a professor at Stanford University for almost 2 decades. But this time, he's not only the teacher, he's also the subject. In late spring of 2024, Dr. Lin was battling a bad cough for months. A CT scan revealed it was non-small cell adenocarcinoma, never smoker lung cancer, and it had spread.
And I ended up having stage 4, which is the most advanced stage of lung cancer, which is not considered curable at all.
The news was a dose of cruel irony. Dr. Lin co-founded the Center for Asian Health Research and Education.
One of our priority areas is lung cancer in people who have never smoked, because it disproportionately affects Asians, and particularly Asian women. You know, I've become the poster child for this disease.
Within weeks, Dr. Lin was in a chemotherapy infusion chair, receiving the same treatment he counseled his patients and students on for years. It was here that he saw an opportunity.
How can I make lemonade from lemons, right? And I thought, geez, you know, when I was a student, if I'd heard a class that was taught by somebody who's both a physician and a patient, it would just so much change my perspective.
The class is called From Diagnosis to Dialogue, a doctor's real-time battle with cancer. Within minutes, the class and the wait list was full.
Yeah, it was really surprising. Our first session, we kind of violated probably some fire codes by having too many students show up. They were sitting on the floor.
How do you deal with a lot of the ethical considerations?
Isabella Hefferman was one of the lucky ones to get a seat.
What really stood out to me was from the first class, he very openly, very upfront said that this is a terminal diagnosis. And so I was just really in awe in how well he's able to discuss this, and just the bravery, but also the emotions he brings in.
The 10-week course covers the entire spectrum of cancer, as seen through the eyes of someone who is living it.
And some patients don't want to engage. They don't necessarily want to know all these details. So I really wanted to share that personal experience of what it's like to be, to suffer from side effects from chemotherapy, to talk about nutrition with my wife. What do I eat? To talk about, spiritual care.
Each week, a new topic and guest lecturer, like Dr. Heather Wakely. Dr. Lin's oncologist and a leading voice in the research of lung cancer and never smokers.
In medical school, we learn a lot about the pathophysiology, the disease itself, all of the details, the cells, the molecules, it's all down deep. And we also learn about interactions with people. But sometimes the whole connecting the two can be a little bit harder to see.
And his wife, Christine, who has her own experience when it comes to living and loving someone with an incurable disease.
What's happening today is something that you have control. And don't read too much, actually, believe it or not, about statistics or outcome of what happened to other people.
We were able to get a bigger room on some days like this.
Dr. Lin plans to teach his class for as long as he can. The syllabus, like his cancer journey, may change, but his mission remains the same.
Heart disease and cancer are the leading causes of death in the United States. So this is going to impact somebody you know closely, maybe yourself. So I want them at an early age, when they're young and healthy, they're seemingly invincible, to really get a sense of what people go through as they deal with a very serious illness.
Lessons like these only come around once in a lifetime. Lung cancer rates among Asians who never smoked is on the rise, especially for women. Of the Asian women diagnosed with lung cancer, 57% are never smokers. That's according to a study by leading California medical centers. For all others, only 15% had no history of smoking. Now, we have extensive coverage on this issue on our website, KPIX.com. We also have a link to the YouTube page where you can find all of Dr. Lin's classes.